We're going to get started. We have most of our folks on here. So, um, we are going to, I'm going to kick it off with Amy Clausen's going to unmute herself from, Ohio Family to Family. And, we already talked about the housekeeping notes. CPDUs will be available in 24 to 48 hours. We're going to do a few introductions. I'd like to start off by introducing Amy. And myself, actually. I'm Lisa Combs from the Ohio Association of County Boards. Most of you all know me. I am the SSA advisor for Ohio Association of County Boards, and you are here at the third session of the summer series. I wanted you to know how we came up a little bit with this particular topic. Amy Clausen from Ohio Family to Family and I were on a work group, which she's going to be talking about later, the Ohio Nursing Coalition, and one of the top things that we talk about on that is the shortage of nursing. Big surprise. You're going to hear about that today. And about kind of misconceptions across the field with SSAs, with family members, with providers, about what nursing is available, what the rules are, all kinds of things. Amy, you want to say a few words about yourself and our work that we've done today?
Yes, thanks, Lisa. I'm really excited to be working with this team of panelists, but mostly the two parents. As much as I love the wonderful colleagues at the state level and Lisa, I love you all. The parents are taking their time away from their kids who need nursing care to do this today. And, their lives are very different than most of yours, I assume, and my own. And I've had the luxury of knowing many, many, many families just like them over the last 9 years that I've been working at Ohio Family to Family. And there's just a huge amount of stress that the complex rules and lack of nursing um, services are out there, not because of the system, but because there's no nurses or very few. So the more we can work together to teach each other was part of the priority of the Ohio Nursing Collab that Lisa mentioned, which we have done for several years now. And so, on a professional note, I am with Ohio Family to Family. I have two other colleagues in the state. We are grant funded and we offer free navigation services, support to families who have children and youth with special health care needs. So, nursing has been a huge priority for me in the last 9 years, and it's really a pleasure to be here today. Thank you.
Thanks so much, Amy. This has been a really, all the panelists. I'm not going to read you guys the session objectives. We're really going to talk a lot about state plan, private duty nursing, waiver nursing, and state plan home health nursing. I mean, that's what none of us really, I mean, I was an SSA. Maybe you all know a lot more than I do. I hope you all know it. When you do, you can call me and I'll send you to Donna and you can get a job with her because she needs help. But we really want to kind of bust some myths. Amy really has told us some things that parents are hearing across the board, and not just Amy, but other people on the Nursing Collab have talked about it regularly. And that's the biggest thing we want you to get is that maybe what you thought was true isn't maybe true, right? There's actually a lot more going on. So I want to keep moving and I'm going to go ahead and introduce the panelists. We're just going to do a quick hi to everybody so that you can see them. And we've got obviously myself and Amy. We have Donna Patterson. And you gotta do the parade wave, Donna. I know, everybody loves Donna. If you don't know who Donna is, then I know that you have not done any nursing on your caseload because if you do, then you've talked to Donna. We also have Linda Donchus. She is an RN with the Ohio Department of DD also. Linda, the old parade wave. I don't know if they can see everybody if you're not unmuted, but Linda is here. We have Tam Lentini, who's an RN at Cuyahoga Board of DD as the Health Services Manager. She's been a godsend for me because she's, from the county board perspective, been able to give a lot of help. And then, of course, as Amy said, we have Becky Meyer, who's a parent of a person who receives nursing services, as well as Patty Mosier, who is also a parent. So you're going to be hearing from all of these people, and it's going to be great. We will definitely give you more information as we move through. All right. I just want to be clear. There's a lot of acronyms in our system, and most of them I think you guys know, but I want to be clear so that when we're listening to this, we all understand them. There's a few that they threw in here on me for nursing that I thought we want to make sure that you all know. So obviously, anytime we're talking about DD, we're talking about the developmental disabilities, the Department of Developmental Disabilities nursing. We're going to talk about DD, waiver DD nursing, okay? This is one I didn't know. They were just dropping it in all the time. I think it's Linda and Susan. They were all talking about OBN, Ohio Board of Nursing. This is a big deal because nurses have an entire different entity that they're following besides the Department of DD. So it's super important to remember that there's rules related to the Ohio Board of Nursing. Hopefully a lot of you do know PDN, which is private duty nursing, because that is it's a waiver service. So hopefully you know that, but again, if you don't, here you go. It's also super important that there's different sets of rules and laws. We have the Ohio Administrative Code, which is where a lot of the DODD rules are, but we also have the Ohio Revised Code, which is actually law, and I believe supersedes our rules even. And probably Board of Nursing stuff. I'm going to look at Donna right now. I'm like, Board of Nursing stuff probably goes in ORC, right, Donna? Or yes. Okay, good. I'm not silly. Okay. Hopefully you all know what HPC is, Homemaker Personal Care. I'm hoping you know that one. And I'm hoping you know Ohio Shared Living, OSL. But again, that is a service that some of you may not have a ton of experience with. So we just wanted to remind you of that. All right. Okay, next. So this is, acronyms. You know how I like my open future learning. Let's just play this and hopefully it actually plays. Let me make sure I didn't. Whoops. Oh no. It's not playing. Oh, yes, it is. Here we go. Let's see. It needs to load up real quick and see what. Well, maybe it isn't going to play. I might have to play with it. I didn't test this out. I was always supposed to test this out. Amy, can you just tell me what it says? Do you remember? It's not
It
done.
was super
It's so
sweet.
cute. Hold on. I have to do
Mhm.
this. I have to stop share and then reshare and make sure that I'm sharing sound. Hold on. And maybe it is uploading while we're doing that. Okay, now I'm gonna share again. Sometimes that works.
Come on, PCP meeting?
ISF?
Up on my ICF?
No. SLP.
You got my IPP? You got my ISP?
No, I haven't. Actually.
PBS?
PDD?
ID?
PD?
DS?
DSP.
What?
You know what I mean, right?
Why do professionals talk like this?
Well, when you are supporting people who have a difficulty with learning,
It doesn't make much sense, does it?
NO.
Get out with LPP, yeah, you know me. Who's down with LPP? Every last on me.
Oh my goodness, I love it. All right, I'm glad it worked. There you go. That was the lightest moment of the day. I hope you enjoyed it. Now we're going to get into some really exciting stuff. So, all right, I'm going to turn it over to Amy to talk a little bit about words matter.
Words do matter. And even though this is somewhat of a very complex topic, we do need some levity throughout these presentations. And we just so appreciate SSAs in our children's lives. And so, on that note, words matter. And so, when we, oops. Can you go back, Lisa? When we talk today about DSPs and caregivers, we're going to call out right now in the beginning and just say we are actually talking about a direct care worker, direct support professional, home care worker, HPC providers, staff, independent providers, agency staff, caregivers. For today, they all mean the same thing. So just so you know, right off the bat, DSPs mean all of these. Next. And shall we get started then with myth 1?
Yeah, I already forgot, Amy, if you're reading this one or me.
I'm reading it.
All right, good go. So this is what we're going to do. We're going to go through myths, see how quickly you all catch up on our techniques. But we are definitely going to be reviewing myths the entire day and then explaining why the answer is the answer. So Amy will kick us off with the first
Okay,
myth
you
that I had
guys.
heard.
Yep, here we go. Myth number 1. We hear this a lot. When someone has a DD waiver, there's only one way to get nursing at home. And Donna's gonna take this myth on.
That's right. That's right. Before I even give the answer to the myth, first going to give a little side note. And that is, we're going to talk about these particular areas, but, it's only going to scratch the surface of what exactly the services are all entailing, when you can use them, how you can use them, what's the payer source, how you decide which service is appropriate. I do have a more in-depth training. It's 4 hours long, but it seems like just 30 minutes. When I'm in the room with you, it goes so quickly and it's not nearly as complicated. Right. But at any rate, if your county board would like additional training specific to nursing services, that would be state plan home health, state plan PDN, as well as DD waiver nursing. I would be happy to schedule some sort of a training session with your county board. You can just get in touch with me via the TDD inbox or directly to my email address. And I think Lisa has our contact information listed at the end, and I'd be happy to hear from you. So the answer to this question is, can you have a DD? Is there only one way? And of course there's not. There's plenty of ways, but it depends upon who's the service for, what's the service need to do, who's going to be the funding source, what particular waiver are they enrolled in, is that particular person enrolled in a managed care? So you see there's different, we have to know what programs are available to know which one would best meet the individual's needs. The first thing everyone needs to realize is that state plan is like an umbrella that has two particular benefits underneath that umbrella. I hear a lot of people refer to state plan when they actually mean state plan home health, but PDN is also a state plan service. So when you say state plan, you have to be able to differentiate, is this a home health nursing service or a PDN nursing service? The big difference being the length of the visit. Also, the provider. For state plan home health nursing, the provider can only be a Medicare certified agency. For state plan private duty nursing, that's for more prolonged visits, then that provider can be a non-agency provider or an independent provider, an agency, a provider type 16, other approved accredited agency, a Medicare certified agency. In other words, what I'm saying, the options are more open as far as the available providers for that service. That said, state plan home health does not require DODD review or approval. I don't know if any of you have been here a long time, but you remember they used to be called core services. And that was back when you can get intermittent visits. That is a visit that's 4 hours or less. And it's, again, by a Medicare certified agency. And if you have to have a prolonged one, then, you can go to the PDN or DD waiver nursing if that individual is enrolled in a IO waiver. So as you see, there's plenty of options. 3 immediately, you have to determine, is this going to be an intermittent visit, a prolonged visit? Does it meet the criteria for a PDN? Because PDN does require a review through the department. You have to gather the information. We have to determine medical necessity, and an individual may or may not have that service approved based upon their assessed need, the interventions, and the interval of time it takes to perform that. Because remember, for PDN, you have to have a need for skilled nursing. It's not just a task, but does that task require a license to perform it? And is the nurse going to be performing that task or a multitude of tasks that require a license that's going to require more than 4 hours in duration?
Hey, Donna,
Also,
do you
yeah.
want me to, what slide do you think we're on right now? I know
You
you're
know,
going.
I don't know. I see you kind of flipping around,
I
but
know, I was
I'm
trying to do
easy.
the,
I can go with it, and whatever you're saying, I can say
well,
something
I
about
don't
it.
want to mess you up. You tell me and then I'll just
Yeah,
switch when you
if
tell
I
me.
were you, just go back to the PDN slide if you don't mind.
Yep.
There you go. Okay. So, if you have an individual that has a nursing need, again, that's going to be greater than 4 hours, we're going to start off by getting the needed documentation. Sometimes if you have a person coming from the hospital, you may have discharge instructions from the hospital. We can take that to be support as far as medical necessity for the service to be approved. Uh, if it, you have to know, or please get in the habit of asking if the individual knows if they are enrolled in a managed care. Because if they are enrolled in a managed care, they can be enrolled in both the managed care and the DD waiver at the same time, which is fine. But we have to remember that managed care approves all state plan services. And remember, I told you state plan covers both state plan home health and state plan PDN. So you would have to get approval from their managed care organization that's for an intermittent visit, that would be state plan home health, as well as for PDN. So please inquire. Sometimes, honestly, the individual is not sure whether or not they are enrolled. If you come across that situation, you can always send me their name and their Medicaid number, and I can look that up for you, because we don't want to have two agencies with an authorization, and one of them is not going to get paid, because only the agency that has the approval by the managed care can bill and be paid. And we don't want there to be confusion or conflict over reimbursement. So please get in the habit of asking about managed care. And we're finding that managed care is becoming a more and more frequent occurrence, where initially, there were just very few, but now there's quite a few. So please remember to ask for that. So state plan PDN does require a request to be sent to the TDDM box with all the supportive documentation in order to prove medical necessity, so that you can get your approval for those services. Okay, now you can go to the next one. State plan home health, we've talked about that already. Again, being that it's an intermittent visit, that is, whatever task is being performed can be done in 4 hours or less. That's the most important aspect of a home health visit, is that it's intermittent. The next is there is a rule about it being a maximum of 14 hours a week. However, there is an option of getting more than 14 hours a week for adults if it's medically necessary. There's a review process through Department of Medicaid, and an approval can be received for more than 14. Again, if you have someone with an intermittent need, but they're enrolled in a managed care, please be sure that those services are requested through that managed care organization by their provider. All right, the next one is DD waiver. So if a nursing visit does not meet the criteria for a state plan home health or a state plan PDN visit, if the individual is enrolled in an IO waiver, then there's the potential of utilizing DD waiver nursing. DD waiver nursing requires a special certification through DODD. In other words, just because you have an active ODM provider number for PDN service, that does not immediately mean that you can provide DD waiver nursing. You have to go through our provider website and request and apply for DD waiver nursing certification. Once you get that, you can be a provider of both PDN and DD waiver nursing. An example of when you might use waiver nursing as opposed to a state plan service is, let's say that you've got a non-agency LPN with an RN supervisor. You have an individual who has a need, but their nursing need is only going to be intermittent. And you have searched, and I know Amy's already gone over, the difficulty with locating providers. That's especially true of some services when you're looking for state plan home health to try to get a Medicare certified agency. If you've exhausted all means of getting a provider for state plan home health and they're enrolled in an IO, then it no longer meets the definition of having a state plan home health. So you can utilize DD waiver nursing. We have also done that for PDN. If for some reason the only available provider for an extended visit, that is a visit greater than 4 hours, is what we call a provider type 45 or a DD certified agency, we have on occasion approved waiver nursing rather than PDN based upon available provider. So if these circumstances come up, you can always contact me and we can talk it through, see what you have. We know what we would prefer to do. Obviously, we have a rule that says state plan services come before waiver, but we also know that needs come before rules. So whatever we can do to try to get the appropriate person in there, then that's what we're going to do. Okay.
Awesome. Amy, did you have, I think Becky or Patty might be telling us a little story. Give us some examples of what this is like, right?
Yeah, I wanted to say thank you, Donna. You're never allowed to leave this position you have. That's an amazing summary of what we're talking about today. It's amazing. And thank you for also saying it's about addressing the need and not how we get the needs met necessarily. So with that, I do want Patty and Becky to please turn on their mics. Let's have Patty go first. Patty, could you say hello, explain why we asked you your experiences today, what waiver you're familiar with, what nursing services your loved one uses. Thank you.
Sure, sure. Thanks, Amy. I appreciate being on here. I have adopted 5 children, all with various levels of disabilities. 3 were medically fragile. 2 have passed away, but my son now, we use PDN and waiver nursing, and it is difficult to find people. I have been very, very fortunate to have longstanding nurses, which is a miracle. One of my nurses has been with us for, I think, 15 years now. So I guess we must be pretty okay to work with. But finding other nurses sometimes is very difficult. We have the IO waiver. It's basically kind of working with the process. It's just, Caleb has a lot of needs and a lot of processing, and it was a little scary at one point. I think it has changed since, but you weren't allowed to use HPC as well as nursing there for a while. Or if it was, we were afraid to, because you're afraid that you might lose your nursing. So there was some fear involved, and it is a little stressful as a parent to try to fill needs. So I use agency as well as the independent nursing, and it works beautifully right now. I am kind of dabbling a little bit into a possible, HPC. I happen to know her. She's trying to get her license as we speak as an independent. So I feel like I'm rambling there, but that is where we come from. And And that
Thank
is
you.
the process. So, yes.
You did great. Thank you, Patty. I think that gives the SSAs today a flavor of, you know, personal lived experience and how hard parents and families work to make their loved ones' needs get met, you know. And Becky, will you please introduce yourself as well?
Sure, I'm Becky Meyer. I'm the parent of a medically fragile 22-year-old. We originally had a different waiver. We were on the home care waiver, and in the last, I have no sense of time anymore. It could have been 8, 10 years ago. We moved to the IO waiver. And I can concur with Patty that I also have PDN and I have waiver services, and you have ups and downs. It is difficult to navigate the system and understand. I learned something from Donna's presentation and took notes myself, and I've been dealing with this for 22 years. So that was helpful, Donna. Thank you. And I think that that's part of this is key, is that as parents we don't even necessarily know the system. We just know enough to get through and get what we need, and to try to get what we need for our kiddos. I do use agency. I do use independence. I do have fears every day of what's next, and continuing, our services in the nursing realm. I think the key is how do you navigate and locate agencies? How do you navigate and find independence? And that's a challenge for all families. So you can have the waiver, you can have the need, but you may not find nurses. So, and that's something that the families are navigating, and it is stressful for them. I think, just recognizing that stress, is helpful as an SSA.
Thank you, Becky. Perfect. And Lisa, you have the next
Right.
myth.
Perfect. We're going to move on to our next myth. So we busted one. There's lots of ways to get nursing. We figured that one out. Let's go to myth number 2. We've talked a little bit about this, but we just want to make sure we want to hit it hard. If you have managed care and are also enrolled in the IO waiver, you cannot get nursing. Is that true, Donna Patterson? I don't know.
That is false. That is false.
Wham. There we go.
However, you can have nursing, but you must ensure that if this is going to be a state plan service, that would be state plan home health or state plan PDN, it has to have the approval, the authorization has to come from the managed care. There are several managed cares out there now. I don't want to say the exact number because I think I might be wrong, but it started out with like 4 or 5, and I think we're up to 7, 8, 9, something like that. So that every region of the state has more than one managed care to choose from, that they can select because of benefits one over the other. And so we work in collaboration with the managed care. Ultimately, they do the authorization, but those services still need to be accounted for in your ISP. If you've got someone coming into the home of the individual that you're assigned, that service needs to be recognized and needs to be included because they're providing a service. So although it comes outside of DD authorization, we still have an inclusion of their service and what they're doing, and if that's meeting their need. We don't typically supplement state plan services with waiver, but again, you heard me say we don't typically. There are some extenuating circumstances that we've had to supplement on occasion, but again, we have to know managed care goes first. They give their authorization, and they run into the same thing that we do, and that is looking for providers. They do have more providers to choose from, so it seems at times, because of reimbursement rates, they're able to negotiate rates, whereas Medicaid is a flat fee that we are not allowed to negotiate. So oftentimes it may behoove the parent to stay enrolled in a managed care because of that option. Also, if they decide with anyone who's enrolled in a DD waiver has the ability to opt in and opt out of managed care. This gets a little complicated, and I don't want to take up you guys' time to talk about managed care, but they're the only waiver that allows opting in and opting out. So if you have someone who is in a managed care, they do have that ability to opt out and go to DD only. However, they have to investigate what is that may affect their doctor, that may affect their pharmacy, they may affect, whatever benefits that came with that particular managed care organization. So we don't want to enter into a decision willy-nilly, but know all the potential complications. But it is the right of that DD individual to opt in and opt out. But if they are in a managed care, please, again, I'm trying to prevent, obviously, we've had this happen in the past where DD gave an authorization and the managed care gave an authorization, and then someone didn't get paid. So we have to know their authorization goes first. And again, if you have any questions about whether your individual is enrolled in a managed care, you can always send me their name, Medicaid number, and I can look it up for you. Although the providers are responsible to check Medicaid status monthly for their individuals. But here we are. That's what we want, but then we live in the real life where sometimes that doesn't happen. So please, if you have a question, just let me know. Thanks.
Thanks, Donna. All right, another myth busted. All right, we're going to go on to myth number 3. A doctor's prescription guarantees home nursing. I don't know. Feel free to put in the chat box what you think. Is that true? Is it false? I don't know. I feel like it's fairly obvious. Donna, what do you think about that one?
Well, I'm going to vote for no. It is not. Obviously, we have to have a doctor's input. I tried when I'm talking, a lot of times I tried to compare us to an insurance authorization. We don't order the visits. We don't order the amount of visits per day, hours per day. That comes from the doctor based upon his assessment and the assessment of the nurse that's in the home. That's what's called a plan of care, where they develop, here are the diagnoses, here are the medications, here are the functional limitations, here are the interventions. And obviously we have to have a doctor approval for that. But in and of itself, the doctor just ordering something is not enough. We have to have support for medical necessity. If we have a doctor's order for a service, but we don't have any sort of documentation that that service is actually being provided or that they're performing skilled care, then it doesn't support the order. So it's sort of a combination. Yes, we have to have a doctor's order, but it's not the only thing that's required. Any of you who have worked in the county boards, annual redetermination, what do you get? Nursing documentation, medication administration records. You get a nursing task inventory, and then you get, of course, the plan of care. And we review all of those things. There's not one thing that makes that determination. It's a review of all things, just like the assessed need. Whatever's been identified as an issue, is it being addressed in the care that's being provided? That's why we look at documentation. If we look at medication administration records, yes, that tells us what's going on with the individual, but it also gives a hint towards stability. If I'm using a whole lot of PRN meds, okay, well, then maybe that is saying my individual's condition, although it may seem straightforward, is more complicated because of the need for ongoing assessment and treatment. Then we have to know the rules. What does the rules say that this nursing service that can be provided? There's requirements, just like I told you, with restrictions with Medicare certified agencies, state plan home health. That's the only provider of state plan home health. How about provider type DD certified agencies? They have restrictions as well. That doesn't prohibit us from using them, but we have to know what their requirements, their restrictions are. And ultimately, provider availability. I mean, everyone knows we don't have any nurses. We know that COVID knocked out a big portion. We already had an aging population of nurses. I can say that because I'm aged, almost aged out. But we don't have a lot of young ones to come in and take their place. And when old nurses quit or old nurses die, guess who teaches new nurses? That's old nurses. So when they left, the ability to take new nursing students into colleges and into, clinical settings, it diminished because we don't have anyone to be able to provide the training. So it just doesn't hit home health, but it's everywhere that it is very, very difficult to get nursing staff. And so at any rate, although you can have an authorization, it's pretty meaningless if you don't have a person to give that authorization to. And that is something I don't see in the foreseeable future. It's just going to go away. It's something we're just going to have to learn to work with and work around.
And work
Thank you.
together. I think that's the hardest thing. I mean, we like to simplify things, and the SSA might be like, yeah, we just need to get a doctor's order. Okay, follow up after that, right? That might be the first step. It's not the only step. So, all right, I think we're going to hear from Becky or Patty, Amy.
Yep. So I'd like to hear from Patty first, if that's okay. How was this process for you when you first, maybe it was a while ago, I get it, when you first needed to get a doctor's prescription and you were sitting there going, yay, we're going to get help. And then what?
Yes, that sounds so simple. Donna said it beautifully, and I have learned, we've worked with Donna's over the years, but we have learned and it's quite the process. It really kind of does boil down to the nurses really paying attention to their charting as well, because sometimes some of the agencies have very simple forms that it's just a matter of putting a smiley face or doing this or doing, very simple forms, which is not giving on a day-to-day basis a real depiction of what the needs are. So trying to constantly say, please chart, please put details in there. If you need another page, do another page, because it gets, as I said, I've had nurses for a long time. You get familiar, you get, it's easy. Not easy. He's medically fragile, but still, it's like it becomes kind of a rote behavior after a while. But for certification for all of this, you do need documentation, and it's a kind of a constant process throughout the year, instead of just pulling the notes at the last couple months of notes. You want to make sure those are processed. So constantly making sure that is part of it is really important. And of course, like you were saying, Donna, about the provider availability, it's not only is there a shortage, but not everybody can be a home health provider. And that is everybody's got their gifts, but it's a very special thing to be working in a person's home. It's just a whole different ballgame than having backup as well. If you are in a facility of some sort, you have backup of other nurses or physicians and so forth. You don't have anybody. And as a parent, we're really doing your training. I mean, we are training you on everything from, basically, where things are to all the special needs of our child. So it's a whole different bird. So those were some of the processes that I found throughout the years, many. So
Thank you. Very valuable. Thank you for sharing. Becky, anything you would like to add to your experience after getting the doctor's script?
I think the key for families is that it's not just the doctor's script, it's not just finding nurses. There's a lot to this process that, as an SSA or even as a family, you don't know. And so, like Patty and I have learned over time that those pieces of the notes and understanding what the board is going to be looking at, it's helpful if that's part of the training process for families once they obtain the waiver and need the services. And I think sometimes that that piece is skipped. And then when it comes down to certification, it's easy for the reviewer to be like, well, it doesn't look like you need it, you know? And so it's really helping each other be set up for success. Because I think a lot of times families are just trying to find other people that can teach them. And I think as an SSA, it would be helpful to just have some tips and information up front.
Great. Thank you so much. This is me. We've busted one myth again, so now it's number 4. This one says a parent as a nurse for adults or minor child cannot be paid to care for their adult child. I'm sorry, I brought in minor here. This one is specific to adult child.
Yes. A parent who is a nurse cannot be paid to care for their adult child. All right. I don't know.
All right. Well, I want to tell you that's sort of true and sort of false. Um, a parent who is a nurse can, CAN, be paid to take care of their adult child. But if that parent is also the legally appointed guardian, then there are stipulations to that. And, it goes back to ODM has some rules, it goes back years of when did you become the guardian. So there are more steps. But a parent, if you are not the legal guardian for state plan PDN, yes, you can be an employee of an agency, or if you are an independent provider, whether it's an RN or an LPN, and you have an active ODM billing number, you can, CAN, be a paid provider, either through the agency or independent. If it's state plan home health, you must be employed through a Medicare certified agency. And why do we require that? Because only a Medicare certified agency can provide state plan home health nursing. With respect to DD waiver nursing, again, if they are not the individual's appointed legal guardian, and I say legal because we have some that believe that they're the guardian, but they've never gone through the legal process. They've just assumed that role, but legally they're not in that role. But if you are their legal guardian, then there are more steps that have to be investigated before you can become a paid provider. But if you are not their legal guardian, then yes, whether it's an independent provider or an agency provider, you are allowed to be a paid nursing provider to your adult child. Thank you.
All right.
Thank you.
Awesome.
Beautiful. And then number 5.
Let's see.
Drum roll. A parent who is a nurse cannot be paid to provide nursing services for their minor child.
So the answer
just-
to that is yes, they can,
Oh.
but they cannot be a paid provider if they are an independent provider. In other words, the only way that you can be a paid provider for nursing services for a minor is that you must be an employee of an agency. The parent does not receive the authorization. The agency receives the authorization, and the agency is responsible for the oversight of the care that's being provided. It has the same rules for a parent as an employee as they do with any other employee that's providing a nursing service for an individual. So you can, but again, you must be employed. The parent must be employed through an agency in order to be a paid provider of nursing services to a minor. Thank you.
Awesome. Awesome. All right. That is myth 5. So I think they're catching on. Do you think they're catching on that these myths are generally false? I don't know. They still are guessing. Let's see. All right. So myth number 6.
Well,
Nurse-
Lisa, let's just re-emphasize again.
Mhm. Mhm.
These are the myths that we often hear families
Yep,
tell us.
yep.
And then through the Ohio Nursing Collab and other partners that are on this panel,
Mhm.
this is how we came up with the myths. It's because families are super stressed. They're hearing these yes, no answers from SSAs, and we just need to get rid of the myths that are false. So thank you for
Yeah,
listening.
and that's really, that is exactly, thanks Amy for, reminding us where we came up with these. And it really, for some reason, and I know a lot of SSAs are giving great information at meetings or following up if they don't have that information, which is of course what we want you to do. But somehow families are walking away and thinking these myths. So we want to make, that's why we're doing it this way, right? That's why we want to get the best information out as possible. So either we're not doing a great job of explaining things, um, or we don't understand. So, all right, let's keep going. We've got myth number 6. Nurse delegation is not needed if DSPs have medication administration certification. Oh God, wait a minute. Did I do this one right? Yeah, I did this one right.
Right.
Donna gets a break on this one. I think
Sure
this is
does.
actually Linda.
It
I knew
is.
as soon as I started like going it, I'm like, oh God, I hate this topic. Okay. Linda Donchis, you are going to help us out with this. Nurse delegation is not
Yes.
needed.
And if you think you figured out the pattern that the answers have been false, we threw this one in just as a challenge. And the answer to this one is really it depends. And
Yeah.
it depends based on the task and based on the setting. So there are 3 categories of medication administration certification. The category 1 authorizes administration of medication by mouth, topically, which would be to the skin, eyes, ears, nose, rectal and vaginal medication. It authorizes inhaled medication, which could be through a nebulizer or a metered dose inhaler, a puffer. It authorizes administration of oxygen and then 13 specific health-related activities. And those could be the vital signs, taking temperature, pulse, blood pressure, use of pulse oximetry, ostomy are a couple examples. And included with that authorization is administration of glucagon, whether it's an injection or a nasal administration. And that task, administering glucagon in that entire package of authorizations with the Category 1 certification, always requires medication administration, Category 1 certification, and nurse delegation. Second are tasks that are not authorized in the MedAdmin rules. So things outside of those 13 health-related activities, nursing tasks, which could be administration of fluid or nutrition through a stable labeled G or J tube, straight catheterization, any of those tasks require nurse delegation only. The Category 2 authorizations are administering medication through a stable labeled G or J tube. Those always require nurse delegation, and a current Category 1 certification, which is the base certification with the add-on Category 2 certification. And then the Category 3 authorization, again, this would be added on to a current Category 1, authorizes the administration of insulin, any route, nasal, inhaled, pump, injection, and also those injectable treatments for metabolic glycemic disorders. Those always require certification and nurse delegation. And then regarding settings, it's specifically identified in DODD Medication Administration Rule, Section 3 of our rule, and it's basically the larger settings. So where more than 5 people reside together, or in adult day service settings that have the capacity to serve more than 16 individuals, Category 1 certification is needed and nurse delegation is needed. Again, those Category 2 and 3 certifications would always be required certification and nurse delegation in those settings.
That is clear as mud, Linda. I love that. No, this topic, you can't imagine the planning group, how much time we spent on this topic, and we know there's a lot of information there, but so we will be sharing out some really great resources too as we get to the end where you can get more information about all of these. All right, so that was a
I
trick
want to
one.
say the chart, the category chart is very, very, very helpful from
Mm-hmm.
what I hear from families and SSAs.
Yeah.
Right, we do have a medication administration reference grid that should be one of the resources, and it identifies the levels of certification, what those authorizations are. It also identifies nursing tasks and then the settings, and it highlights when nurse delegation is needed in addition to the certification. So it is very helpful. It's published on the website and it's in our Category 1 curriculum as well.
Awesome. Thanks so much, Linda. All right, we're going to keep moving. We got myth number 7. Now, here's one where we're combining two different services that are not used a ton, right? So, like, we've got Ohio Shared Living, and then we add nursing services in there. So, the myth that we hear is someone receiving Ohio Shared Living or OSL cannot receive any nursing services paid by Medicaid. All right, I think Tam from Cuyahoga is going to help out on this one. Tam?
All right, so this one is also false, but
Bam.
as you've been gathering with all of our false and false and false, there are no absolutes. There is never a never or an always in almost everything we do, because sometimes people using Ohio Shared Living can have both intermittent or ongoing state plan services. It's always a case by case basis. So we have to be looking at individual situations and what do they need. So if the person has ongoing care that is beyond the ability for the Ohio Shared Living provider to do, then they might be able to authorize PDN services. If they have intermittent skilled care that the Ohio Shared Living provider can't meet because of the health related aspect of them, then home health care might be appropriate. And DD waiver nursing might also be appropriate if they are enrolled in the IO waiver and those needs that that person has can't fully be met by the Ohio Shared Living provider. But all types of nursing, and Lisa, there's one more, if you press
Thank
one
you.
more time for me there
Yep.
so they can see that. Yeah. So everything that is authorized when somebody's getting Ohio Shared Living has to meet very specific criteria that the Ohio Shared Living provider and the nursing services serve and provide very different functions. It has to be clearly documented in the ISP what those different functions are. And the people who are receiving both paid nursing services and Ohio Shared Living services cannot receive both of those services from the same provider. So the Ohio Shared Living provider cannot also be their PDN or home health or waiver nursing provider. We have to keep those things separate, okay? Because remember, if somebody is, if they're living with an Ohio Shared Living provider who holds medication certification level 1, then those are the only things that that person can do authorized. If there's anything outside of that, then they require nursing delegation, as Linda said in the previous slide. Same thing if somebody who has an Ohio Shared Living provider has a G-tube or requires insulin administration, those tasks will have to be delegated with the Ohio Shared Living provider because according to the rule, those tasks are outside of, while you have to hold certification, you also require nursing delegation. So they might need either nursing delegation or, and we'll talk about delegation in a couple slides, or to have a nurse come in and perform those tasks for them. And that extends beyond G-tubes and insulin into things like intermittent catheterizations and complex dressing changes and all those types of things. But for this particular myth, somebody who's receiving Ohio Shared Living can receive nursing services, assuming that they are specifically different services.
Awesome. Thanks,
Thank
Tam.
you.
I think Patty was going to jump in too, right, Amy?
Yes, please, Patty. What do you say about this?
Again, that was one of those fears that I did not want to bill Ohio Shared Living, even though we could, because I was fearful that his nursing would be taken away. So that was the biggest fear. There was no real process on how to do it. Luckily, I have a wonderful friend that had also gone through it. So she was able to kind of walk me through, what do we do? How do we do it? What's the process? And put my fears at ease as well. So this is all fairly new to me, but it is a wonderfully helpful thing. But again, enormous amount of anxiety and not, from an SSA standpoint, being able to clearly explain, this is what you need, here's where all the documents are, this is how you do it, this is no need to worry about it, that sort of thing. So I think knowing a little bit about it and helping the families that are able to do it would be really helpful, because I really did have to go out seeking somebody that knew how to do it to be able to do it. And so since then, I got it, and it's the process is much easier now, but it was that was a big fear. So that was my biggest point there. So
Awesome, thank you. The fear here cannot be downplayed at all. For those of you SSAs that aren't sure or just hearing this for the first time, we hear this all the time from families, how afraid they are that their child or loved one will lose their nursing services. But it's glad to hear this myth being busted today. So thank you.
Yeah, and just remember, I know, from the SSA perspective, it is so hard to be an expert on all these things. And
Mhm.
so when you're working with a family and you haven't done a lot of this before, they are looking to you, to be the expert. And so when you don't know the answer, how you say, we're going to work on this together. I haven't done a lot of this, but I will be working right next to you while we're figuring this out, and we'll do it together, is way different than just being like, I don't know how to do that, right? Like, don't say I don't know how to do that and walk away. That's, please. We have a lot on our plates as SSAs, but we also really, our job is to help alleviate whatever fears we can from family members, and go and kind of guide them through this process. And so that's how we learn. Okay, we're gonna keep moving. I just realized I'm so excited because I misnumbered the myths, and we're on myth 9. We just skipped 8. Yay! I'm so excited. We're more on time than I thought we were. So
Oh, good.
Tam and I are going to take over this one, and the timing looks a little bit off, but we've got myth number 9. If a family member trains a direct support professional to perform a healthcare task, that is nurse delegation. All right, let's think about that. If a family member trains a direct support professional to perform a healthcare task, that is nurse delegation. What's our answer? Tam?
I think I was doing this one.
Oh, Linda. Sorry.
Okay. Just
No
gonna give it to
worries.
Tim. She wanted it. The answer to this one is back to what we said before. It's false. They are distinctly different. Nurse delegation is completed by a nurse, and that could be an RN or an LPN at the direction of an RN. An LPN is not an independent practitioner of nursing, and Board of Nursing Law identifies what the requirements are for that LPN to practice. So there's always going to be an RN involved. It follows the Ohio Board of Nursing rules for delegation of nursing tasks. And those rules the nurse needs to follow in identifying if the person is stable for delegation, if the task is one that fits in those requirements to, in fact, be delegated to an unlicensed person. The rules then talk about what the nurse's responsibility is for training, demonstrating that task, observing return demonstration, and it also specifies what the nurse's requirements are for supervision when that task is being performed by the unlicensed person. Family authorization, which I think historically we've always referred to it as family delegation. The DODD law, Ohio Revised Code 512347, is specifically termed authorizing in-home workers to perform healthcare tasks. So family authorization is similar in a process to nurse delegation, but it's completed by a family. And the law specifically identifies the requirements that must be adhered to, and it starts with the person is living with that family member. And then it identifies what the family needs to look at to determine, again, if that task is in fact a task that's delegable. And then it tells them what their requirements are. They have to have that written direction from the healthcare prescriber. They're responsible for doing the training. They're responsible for providing written directions to that unlicensed person. They can only authorize that task to independent providers who are coming into the home. The rule specifically identifies that it cannot be to an agency provider. The family provides the oversight. And then finally, the law identifies the county board's oversight responsibilities. They've got the ability to intervene. If there's complaints, concerns, questions, they can go in and look at what that process looked like, what the task was, how that independent provider is performing the task, and they can intervene if they need to. And the next slide.
Yeah, this was a big one for me. What do you mean it's called family authorization, Linda? Like family delegation. All right, family authorization. We're going to learn that today. Yay. All right. Now I think we're going to go up. Oh,
We have a couple more on this same
there we
slide. And
go.
just the takeaway was multiple services can be provided in the same setting, depending on what the service needs are and who is providing those supports. And we have a real basic scenario. A person lives with their family, has agency DSP, and also independent providers coming into the home. The person receives medication and nutrition through a G-tube. So that independent provider could provide services through family authorization. The family can authorize the independent provider to administer the medication and nutrition through that stable label G-tube. The agency provider, however, cannot use family authorization. They would require, like we talked about several slides ago, a current medication administration category 1 certification with the add-on category 2 and nurse delegation to administer those medications and nutrition through that tube.
Awesome. Okay. All right. Now I think this is probably where we are going to turn it over to Tam and anybody else that wants to jump in. But another related myth to nursing delegation, an independent provider or DSP needs to have a delegating nurse who has special extra credentialing.
And that is false. A nurse, by virtue of their license, is permitted to delegate. It's part of their scope of practice. It's written in the job description, if you will, for a nurse, either a registered nurse or an LPN. So there's no extra special credentialing that you need to become a delegating nurse. An LPN is permitted to delegate, but an LPN always requires an overseeing RN. So it doesn't mean that the RN has to be directly standing over the LPN, but there has to be a direct relationship between that LPN and the RN who provides that LPN with the plan of care and the it's okay to delegate to this, so you can go ahead and delegate now. So if you are looking for a nurse and somebody says, oh, I have an LPN, that very much could be okay, but it also might not be if they do not have a directing or supervising RN. Okay. Now, having said that, you don't need any extra special credentialing or anything like that, but whoever is the nurse doing that delegation does have to be familiar with the Board of Nursing's laws and rules about nursing delegation, as well as DODD's rules about delegation. So while no extra credentialing is needed, they might need to do some extra reading.
Awesome. All right. Thank you. Okay. Another related myth regarding nursing delegation, it is the SSA's responsibility to find a delegating RN for an independent provider.
Also false. Okay. Finding the delegating RN is the independent provider or the DSP's responsibility. If you need a delegating nurse, it is your responsibility to find one. Okay. Now, your SSA, your county boards have resources. The SSAs have lists of providers and they will help make calls. And at least in my county, the SSAs will help make phone calls, see if agencies provide these services, if they have any nurses available for these services. We can provide those lists to the families to make those contacts. an independent provider or DSP has to have nursing delegation in order to perform certain tasks. So if they are a provider and they say, oh, I can provide DSP services to this individual and I have Cert 3, so of course I can inject their insulin for them. They can only do that if they have a delegating nurse. So they will have to have a delegating nurse or find a delegating nurse to provide that delegation to them before they could be authorized to provide those services. They are also responsible for having the contract with that delegating nurse and potentially paying for that time and service. If, some of them have, hey, my friend is going to do this for me, and that's great, but that doesn't happen a lot. So there is that, sure, making it more complex.
Mhm.
When we say you need a nurse, and this falls back into that whole, we are having difficulty finding nurses. Families are struggling with this. And I didn't know, Lisa, is there a parent, Becky or Patty, to talk about this one as
Yeah,
well?
I think Patty and Becky were going to share something, Amy.
Let's have Becky do this one since Patty took the last one. Becky, we hear this a lot that we don't know how to care for our loved ones who have very complex medical needs, need home care nursing, and there's just not enough nurses around. So, what's your experience been with delegation of nursing tasks, family delegation, or any of the above?
We're new to the delegation piece of this, as my husband recently became a provider for our son. So I will say it's been a little confusing, and it's complicated, right? And so I think it's complicated for not just the families, but it's also complicated for the SSAs because, just listening to the delegation pieces, even from the experts here, it can be hard to follow. So I actually have snipped a few sections of our PowerPoint just to save on the side as this was going on. But I think for me, I heard it said that certain things should be shared with the SSAs, so that the SSAs can share it to the family. We did not receive any of that. So I think if there are documents that can then truly help families with the delegation, that would be key for our success too. Because we want to be your partner and we want to do this well, but it's just hard to navigate like what it all means. And the independent provider locator, if I really wish there was an app that said, click here to locate your own independent provider. But unfortunately, that's just a challenge in and of itself, as there is a lack of nursing all the way around. Was that helpful, Amy?
Yeah, it sure was. Thank you. I think to put a fine point on it, maybe I have dual rules. Of course, I'm a professional helping families. I also have a son with a severe disability who does not need nursing services. But some of the best ways that SSAs have helped us and other families is when they say, well, I'm not sure about that, but let's figure it out together. That statement helps so much. When you say, or when we hear, let's figure this out, because there's a lot of nuances here. So, this is why we're tackling these myths today. Um, it's not a one size fits all. And there's a lot of yeses and nos and maybes.
Everybody. All right, we're going to keep moving. So, Amy's going to talk a little bit more about this ongoing challenges, right, Amy? And you have all the answers for us, Amy.
Ah, well, let's just say that the ongoing challenges started way before COVID, and they've just been exacerbated post-COVID, as Donna pointed out.
Mhm.
So, real quickly, we thought that the best way to tackle this would be to share a little bit more about the Nursing Collab. Um, it's a partnership among families. Three amazingly willing, careful, strong families have been a part of this since 2019, where on behalf of other families and individuals in Ohio who started getting lots and lots of nursing service denials for their complex medical needs loved ones. So we said, hey, let's help. Let's be a part of this process. Let's ask DODD, the Ohio Department of Medicaid, DD Council, and the Ohio Board of Nursing to all come together. We meet quarterly. We talk together about nursing policies and improvements to support the health and safety of loved ones who have complex medical needs. And it's more than complex, it's very complicated. Um, so some of our accomplishments on the ONC has been very much because of the family voice at the table. So it's been an honor and a pleasure. So we asked for a face-to-face nurse visit before denying services so that needs are properly assessed. That was done before COVID. Training and support, just like today, for both county boards, SSAs, and families can receive more guidance to understand nursing services. We helped develop clearer tools that Donna mentioned earlier, such as the nursing task inventory that help SSAs collect information and criteria. We also spent a lot of time creating nursing fact sheets and guidelines and guides for nursing services in Ohio and delegated nursing in Ohio. Um, it's true, the DSP crisis is not just the DSP crisis that we faced a few years ago. We added on to that a nursing shortage crisis, unfortunately, post-COVID. And we're lucky to have partners with DD Council and OSU to do a workforce study to address home care nursing. And so the ongoing challenges are real. There isn't a magic bullet that we can say, SSAs, here's how you can help individuals and families you know. I wish we could say that to you today. But Becky and Patty are going to share shortly how they've found their golden nuggets of nurses and hold them tightly. And we hope that you, as SSAs, will honor that and help families and individuals in the future hold on to and find nurses too. Um, so, with that said, who wants to go first? How about you, Patty? Do you want to do Tam first
It's
or
okay. Patty can start, and then you want to
Patty?
go ahead and we'll sum it up.
Yeah, Patty, how have you found the nurses?
I have, of course, agency, which has a little bit been helpful. Really, it's word of mouth. Other parents some schedules don't work if you've interviewed somebody or you have somebody and they need a different schedule, kind of keeping a community of other parents and other people. I go to social media. That has helped as well. Posting on Facebook, does anybody know of, and the IP portal, where they can then send their interest to the SSAs. The SSAs should then send that to me. Even with agencies or independents, I always insist on doing my own interview process with the person, because as we know, it's got to be a good fit all the way around, which is rough, because I had to do that towards the end of the year, and it was a little challenging trying to get somebody that was going to fit. But and the SSAs, depending on where you are or what processes you go through, a lot of you have your own resources of agencies or people you've worked with. You could put out an email kind of blast to the ones that hey, I've got this family that have this and this need. That's very helpful as well. Really, the word of mouth, and current nurses I have also know nurses, and so we kind of it's a you scatter everything out there and hope that something hits, at some point. But that's kind of the process, and it is a lot from a parent standpoint, because all these other things we've discussed today are on our plate, as well as caring for our child or our family member. So it's very nice to have the support and the empathy and the concern, as Amy has said, like, let's do this together, is probably the best takeaway from everything today, that gives some sort of anxiety releasing, process there. Just let's do this together, and let's find what you need. So
Thanks, Patty. Well said. Appreciate it. If it's okay with everybody, let's let Tam go through the slides and the information, and then we'll have time here shortly for others to chime in.
Perfect.
What
All right, Tam.
is Tam going through?
Just this slide, we didn't really talk about it. Any other tips from Cuyahoga or from you around finding nurses?
Okay, got it. Got
It's
it.
okay.
As far as, identifying it really is like, as Patty was saying, it's really word of mouth. Within Cuyahoga, as far as nursing agencies, we have many nursing agencies. If you need a delegating nurse, we have a very limited number of nurses who do delegation within our area. And our area generally means like 3 or 4 counties within our area where a provider or a single nurse serves. So absolutely talking to the individual who's receiving services or their family. Is there somebody they know they have in mind? Do they have a friend who's a nurse who would be willing to provide the services? Maybe the physician or their nurse practitioner knows of things, depending on where, like if they're a specialized care clinic, they may have options. And it really is a complicated process to try and find nursing services, but they are out there. It's just there's not as many of them as we like and need. And as Patty was saying, they might not all be a good fit. So you do have to find one that is a good fit with your family or with your individual, because it makes a big difference in how not only the care they receive, but how you feel about that care being provided. So making sure that everybody is comfortable and safe is important.
Absolutely. Thanks, Tam. Yeah. And as an SSA, I mean, even putting out, I mean, connect with other SSAs who've maybe done this in your county if you haven't done it before. Find out who other people are using. Just like Patty mentioned, that's the only way I ever got anything accomplished when I was at Lucas County was, and I know some of your counties are smaller and you only have maybe, 3 or 4 other SSAs, and you also have less nurses, but it really is, it's not fast. but it is just a consistent effort at putting the word out and spreading that word out to whoever you can. So, all
Can I
right.
say one thing,
Mhm.
Lisa, if you don't mind throwing in about, has to do with delegation, and that is to remind the county boards that because we do need delegation services, these RNs and LPNs that perform that service for us can be paid, but the services has to be allocated in the CPT. And, we shouldn't try to like not explain how that they can go about and be reimbursed for their services. That we do have a rule and there's a lot of criteria that you have to meet. I get that, but the county boards need to remember that the service needs to be accounted for in the projection tool and accounted for with the monies to be authorized into the FI system. Thank you.
Okay. I'm just going to grab a couple questions. We only have like 3 minutes and I want to make sure we're done. We're fairly close. So, I do want to, I think some of these are quick answers. If we don't answer you, it's because it wasn't a quick answer and we might have to get back with you. But we had a question, would someone getting HPC also be able to get nursing at the same time as HPC as long as the scope of the practice is different as well? I'm thinking that's a Donna Linda question.
I can take the one for the nursing section. Again, just like we've said before, never say never, never say always. Um, Typically, nursing that's there for prolonged, not intermittent, but if they're there for a PDN visit, a prolonged service, RNs, LPNs perform incidental care, just like HPCs. I mean, like bathing, dressing, grooming, toileting. If that is a part of your care, an RN or an LPN is expected to perform that part of care. There are situations that arise. Let's say, for example, if you had someone that say one of their the skills required was for wound care, and the individual was unable to reposition them. Let's say it's on a coccyx or sacral wound, and let's say the individual is unable to position themselves um, in the right position for the nurse to be able to gain access to that site and to be able to perform the wound care, because we do have some wound cares that are quite extensive and can take quite a bit of time, and it requires more than two hands. Because you can't have the nurse trying to hold them and then trying to do the wound care. So there's always extenuating circumstances, but those would need to be discussed prior to, because again, the expectation would be, if we're talking just straight up bathing, dressing, grooming, toileting, that's a part of incidental care for nurses to perform. If it's an intermittent visit, that is, a nurse is there to perform a task and leave, then an HPC can be there because they're doing two different scopes of care. So that is not an issue at all. It's only when it's a prolonged visit that we have to have a talk to determine whether both services are needed simultaneously or not.
Awesome. Thanks, Donna. Probably another one for you, Donna, maybe. Does DODD need to review the plan of care? I think that's what POC stands for, and
Yeah.
nursing notes from managed care plans
No.
during annual
No,
redebts?
no. When you have a person that's enrolled in a managed care, that provider will receive an authorization letter from the managed care organization. We need only a copy of that authorization. Please read the authorization, because they write on there what their specific number of units that are authorized and for a specific time frame. You never get an authorization for a waiver span like you do with DODD. They're typically 60, 90, maybe 120 days, but our allocation has to match theirs exactly. So if they say 40 hours a week, ours says 40 hours a week. But the only document that we need filed into SharePoint is a copy of the authorization letter that is sent from the managed care to the provider. And then you allocate that into your CPT and you finalize it. You send it to us saying that it's just a managed care authorization, and we can get it approved for you within minutes.
Awesome. Okay. I think Tam is answering one of the questions. So we're going to keep moving just because I want to be respectful of everybody's time. So I just want to be really clear that I put in the chat box a really nice list of clickable resources that you guys will have. It will be on the OACB member Connect website also, along with the PowerPoint. And I do think it has a lot of really nice resources. So be sure to look at that. As far as we talked about, we are in the midst of also planning this kind of session for family members through the Ohio Nursing Collaboration and in cahoots with Amy again. That's a good thing, in cahoots, not a bad thing, by the way, Amy Klassen. So thank you for that. And we may need some of you who have done this to chime in with us and help talk with families about that. Oh, I haven't seen this slide. Amy made it pretty. Amy, I know you got to go fast, so you got
That's
any?
okay. I don't need to, folks can read it. We're here to help families who have children with special health care needs and disabilities, also youth and young adults with disabilities. We help families for free, one-on-one, understanding these types of rules, how they may help them, and work with SSAs collaboratively regarding nursing services, DD services, health care, therapies, camps,
Yeah.
transition to adulthood, all kinds of things. So feel free to share out our website using the QR code or an intake form with families you know. We're
Absolutely.
statewide, so.
Super helpful. I think Amy had a great story about a family that didn't reach out to her, and it took 2 weeks to understand a process that she could have explained in probably 10 minutes. So it is very helpful to have family to family on your team. Here's some contact information. Some of the questions in the box is, oh gosh, how can I contact these people? Well, they all gave their emails direct. So that will be in your PowerPoint. Thank you for doing that. Really appreciate that.